Hi, my name is Ben Brady. In this presentation, I will be discussing principles of promoting responsible cannabis use with lessons for future professionals. At the beginning, I'd like to recognize that this presentation is supported by the Comprehensive Pain and Addiction Center. The Pain and Addiction Center is located here at the University of Arizona. I would also like to acknowledge that the University of Arizona is on the land and territories of indigenous peoples, including the O'odham and Yaqui tribes. Today we have three learning objectives. By participating in this presentation, you should be able to identify cannabis use risk factors, describe how harm reduction principles promote responsible cannabis use, and give examples of what responsible cannabis use can look like. This presentation is directed towards pre-professionals who may be in positions where they will be serving individuals who are at risk for use, or who currently use, or who experience harm from cannabis use. But it's also for individuals who currently or may potentially use cannabis themselves. We want you and all of these folks to be more informed and to be as safe as possible. In this presentation, we will review a few key principles related to responsible cannabis use. They are not the universe of facts or points that could be made or discussed about cannabis. Instead, there are 5 points that we identified and would like to present to you to emphasize how, as individuals and as potential future professionals, you can understand what responsible, safer, and lower risk cannabis use looks like. I'll introduce and briefly explain each principle and give examples to demonstrate their relevance and application. The Comprehensive Pain and Addiction Center supported this project, and that this training was part of AzCANN, the Arizona Cannabis Education Project. And AzCANN is supported by the Arizona Department of Health Services Office of Health Equity. The content in this presentation represents mine and my team's view, not necessarily those of ADHS. So key principle 1, harm reduction is an inclusive, effective, and science-based approach. You've probably heard the expression, an ounce of prevention is worth a pound of cure. This is a logical statement. It makes sense, and it seems better to stop something bad from happening rather than to fix a problem that's already occurred. In this way, prevention seems efficient, cheaper, and less chaotic. And for the past century, US drug policy and education programs have largely operated under this rationale. Preventing any and all drug use seemed like the best way forward. This is an abstinence-based approach. In the name of health, US policymakers have enacted drug policies that sought to control behavior under the idea that if one never uses drugs, then they'll never be harmed by them. Unfortunately, this logic doesn't always work in practice for a couple of reasons. First, most people at some point in their lifetime use alcohol or a drug that has the potential to harm them. And most people consume at some point, and many do so without experiencing health consequences. Second, there are a lot of harms associated with drug use that are created through our efforts to enforce abstinence policies, not just from drug use itself. And third, much of the health harms associated with drug use, like overdose or bloodborne infections, cancer, or other chronic diseases, could be prevented without requiring abstinence. So abstinence is an approach that has benefited many. And in our prevention efforts, harm reduction can be, and our position in this presentation is that it should be added as a science-based, cost-effective approach that benefits people who want to use a psychoactive drug but aren't willing or able to stop. So recognizing this, it's reasonable to shift our focus from prevention as a behavior-focused strategy, i.e. no drug use, to prevention as a harm-focused strategy that promotes responsible forms of drug use, in addition to abstinence and other primary prevention opportunities. As the story goes, we've been told that an apple a day will keep the doctor away. That's prevention. What about this version of the story? How about a sterile syringe a day will keep HIV away? That's also prevention. In this, we are shifting our focus from preventing heroin injection to preventing HIV transmission because of needle sharing. If this sounds radical, I'll point out that harm reduction is a mainstream public health concept that's practiced broadly in the area of substance use and in many, many other areas. Seatbelts, helmets, airbags, for example, these are strategies that have been introduced that don't seek to reduce us from driving automobiles or motorcycles or bicycles, for example, but they do reduce the risk of injury. That is also possible in our drug policy. The federal government calls harm reduction a key pillar in its multifaceted disease and overdose prevention strategy. So for this presentation, we want to focus on safety and reducing harm as a key principle in promoting responsible cannabis use. This shift includes a focus on behaviors that are easier to change. The benefit is that interventions that are more realistic and pragmatic are also more inclusive. The public health prevention model highlights primary, secondary, and tertiary prevention efforts. All are prevention, whether avoiding the onset of disease, disease symptoms, or disease progression. Our hope is that we can have something to offer everyone, regardless of their drug involvement or exposure. This leads us to the next principle. Drug harm occurs on a spectrum of use. Drug use can be dangerous, but that's not the same as saying that all drug use is dangerous. So the second principle highlights that drug harm occurs on a spectrum of use. Understanding this is helpful for understanding how to reduce harm and encourage responsible use. So ranging from no use, there are also low-risk ways of using cannabis, including medicinal or religious purposes and recreational purposes that follow safe use recommendations. There are also higher risk ways of using, where a person uses too much, too often, at too young an age, or illegally. Harmful effects are expounded when use becomes chronic and compulsive due to addiction, or what we now call substance use disorder. So going back to the car analogy, similarly, drug use exists at the intersection of many factors. So if we were to think about car driving, how fast one drives, whether they wear a seatbelt, or the type of car they drive, these contribute to the risk of accident or injury. So too with substances, the pharmacological properties of cannabis product, that'll contribute to the risk of harm, as well as the setting, frequency of use, quantity used, history of use, pre-existing mental and physical health conditions, and numerous other factors. The literature shows us that some of the most influential factors include starting at a young age, heavy frequent use, using concentrated or high THC doses, and using for reasons to check out or to cope with negative life experiences. As of 2019, almost half of all US adults 18 or older reported that they used cannabis at least once in their lifetime. Among this group, the estimated risk of becoming addicted to cannabis appears to be around 10%. However, harm from use and the risk of addiction is almost exclusively concentrated among those who start using young and among those who use frequently. So, where about half of US adults report using cannabis, only half of those folks will ever use more than a dozen times in their lifetime. So this means that about 1 in 4 adults do more than just experiment with cannabis. When age of initiation and heaviness of use are factored, we see that risk of addiction is probably more like 30% among those who start young and use heavily, and around 0% among late starters or those who infrequently use. Those who use before age 15, evidence shows that they're about 5 times more likely to become addicted than those who first tried when they are 18 or older. There are no known fatal overdoses from cannabis. However, high dose use, especially when people are first using or when they have low tolerance, that can be dangerous. That can result in what we call acute toxicity, or where they have distressing symptoms like anxiety or paranoia. Regarding cognition, there also appears to be a consensus that heavy cannabis use makes it difficult to think clearly, remember, and learn. There's also well-documented associations between heavy marijuana use and anxiety and schizophrenia. For this latter condition, however, the relationship appears to go both ways. We know that those who have mental health challenges are also more likely to use cannabis for coping reasons. So when we take all these factors together, one important takeaway point is, and it's helpful to recognize that not everyone faces the same vulnerability to cannabis harm. So like this diagram is showing us, there are many reasons for using, and not all of them are negative. If we were to look at medical marijuana, for example, although understudied and still surrounded with a lot of unknowns, we know that it's a source of help for people with severe health conditions, including neuropathic or cancer pain, chemo-induced nausea, and sleep disorders. And the Federal Drug Administration, or the FDA, has approved some cannabis medications for these conditions. As of 2022, medical marijuana has been approved in 37 US states. Marijuana has also been used for centuries as part of religious practices and traditional medicines in many parts of the world. So again, not using, delaying use, or using moderately, less often, or in responsible ways, these can all be viewed as safer, more responsible approaches to cannabis use. You'll decide for yourself what your relationship with cannabis will be. However, in your relationships with your friends, with your family, and in any role that you take on as a professional practitioner, you'll be in a position to potentially influence others' relationship with cannabis as well. So understanding how this risk falls along a spectrum of use will be important. How you talk about cannabis will affect how you are perceived as a messenger and the effectiveness of your messages. This leads us to our third principle. Credible messages require honesty and transparency. The World Health Organization has outlined 6 components of effective health communications. Messages need to be accessible, actionable, credible, relevant, timely, and finally, understandable by decision makers. In this presentation today, I'm going to focus on one of these, on credibility. Messages that are perceived as honest, relevant, or important require messengers who are perceived as credible. Historically, cannabis education messages have lacked credibility and trust. Our cultural attitude towards cannabis has resulted in commonly overstated risks, beginning with reefer madness earlier in the 20th century. We've been worried, and a lot of our worry was focused on the idea that cannabis is something that's going to make you crazy or can kill you, and is just something that is not safe to touch. Today, and especially with younger generations, nobody's buying this message anymore. For example, from surveys with university students, we know that students perceive cannabis to be exhilarating, adventurous, mind-expanding, curative, comforting, social, and misunderstood. The belief that cannabis is misunderstood matters a lot. It relates to the perception that many health and law enforcement professionals overemphasize or exaggerate cannabis danger. So as messengers, professionals, especially health professionals, if a health professional is only offering prevention messages that focus on harm that should be avoided or risk from use, they're seen as being biased or agenda-driven, and that their messages are dramatized and fear-based. This creates a disconnect and a communication gap with a large number of folks in your audience, those that you're trying to reach with your message, clients or patients that you serve. Unfortunately, if health professionals are seen as overstating risk, people who use substances may compensate too much in the other direction and underestimate risk. Consuming cannabis is not risk-free, but it's also not as risky to consume as some messages suggest. To communicate this in a way that is perceived as honest and unbiased, we suggest making health behavior recommendations in context of explicit prevention goals. In describing harm reduction, I suggest that there can be multiple prevention goals. Preventing any use versus preventing harmful use, for example, would be different ways of approaching prevention. This matters because how health behavior recommendations look depend on the prevention goal. So if one health expert states that, hey, the science suggests that people should never use cannabis, but then another says, hey, the science suggests that there's strategies for low-risk use, these could appear conflicting, contradictory, or confusing. In reality, science supports both positions, only so far as they relate to different prevention objectives. So if the goal is no risk, then yeah, non-use is best. If the goal is low risk, then some use can be okay. I'll use electronic cigarettes to provide an example. In 2018, I was part of a research team that reviewed 81 position statements from healthcare organizations related to vaping and e-cigarettes in 10 different countries. These position statements represented all published, documented statements that we could find at the time. 30% of the statements recommended or voiced support for individuals who smoke that they should switch to vaping to reduce their tobacco exposure, or to use e-cigarettes as a cessation aid to quit smoking. So that's shown here in this table. If you look down at the bottom row, there's types of ENDS recommendations, ENDS meaning electronic nicotine delivery systems or electronic cigarettes. Right, so there's 2 positions of these 5 where electronic cigarette use was either encouraged or supported as a way of helping people to stop smoking. That represented 30% of the positions. 70% of the positions did not support e-cig use, arguing that we should discourage or even prohibiting use for reasons that of precautionary non-use or restrictive non-use or prohibiting use. In highlighting this study, my point is that these statements all came from legitimate health agencies. So why are there so many different positions? Are the experts at the agencies reading different sources of evidence, or are some of them science illiterate? Maybe, but probably not, at least not entirely. Instead, there's a different explanation. If we view the e-cigarette use recommendations as health promotion tactics that implicate use that align with specific objectives, then we can see that vaping can make more sense or not, depending on one's reason for doing it. This shifts the question from whether using an electronic cigarette is good or bad, or to ask whether or what using an e-cigarette is good for or bad for, and whether that's helping to accomplish some predefined objective. This figure from our study highlights this point. So some public health agencies prioritize reducing harm from smoking as their tobacco control objective. That's what we see here on this top row. They recognize that there may be risks of harm from vaping, but there's enough evidence that vaping is less toxic and poses less harm than smoking cigarettes. And there's enough evidence to that end that they feel comfortable saying, look, smoking is so much more harmful. If using an electronic cigarette is a way to help you stop smoking, we would prefer that you vape instead of smoke. Other organizations were focused on preventing any harm. And so that would fall into either potential or expected harm based on their reading of the evidence. They recommended deterring use or preventing e-cigarette use based on their view that we don't know enough about e-cigs, and so we should be cautious. That's this potential deterrence over here. Or that they claimed that we know enough to restrict or prohibit use through legal action. So evidence, data, information, and facts, all of these things matter, but values that inform our prevention objectives, they also matter. And so in promoting a harm reduction approach, we recommend a focus on self-directed responsibility, where people are encouraged and assisted to be safe as possible, regardless of their use behavior. Again, using tobacco and vaping as examples, here's what this could look like. Half of people who smoke die premature. If you smoke, consider quitting as soon as possible. If you're struggling to quit or would rather not quit, consider vaping. Compared to smoking, it is much less harmful. We want you to be as healthy as possible. As I stated before, harm reduction messages can appeal to virtually anyone, regardless of their interests or needs. If messengers presume their audience to be a single, unvarying mass of people who all have the same goals, the same needs, and the same values, that's a problem. Those messengers and the messages they create risk alienating many people, including those who may benefit most from the message. So cannabis, like electronic cigarettes, can be good or bad for multiple reasons, depending on how they are used and for what purpose they are used. So a credible message in that instance can look like this. If you are considering using cannabis, it's a good idea to wait until you are in your mid to late 20s. Cannabis use can be unhealthy, addictive, and expensive. If you use cannabis, consider doing so infrequently and only with legally sold products. We want you to be as healthy as possible. Providing information in a way that allows the audience to make informed, self-directed decisions is important. And that's our next principle. Key principle 4, promote personal responsibility and self-directed decisions. In the past few decades, social norms have shifted around cannabis. Currently, around 90% of US adults support medical use, and around 60% support medical and recreational use. It's important to acknowledge these more tolerant views. Like alcohol, cannabis is entering a social space filled with mixed, but often permissive cultural messages that encourage use. Another way health messengers can be seen as honest and constructive is to offer help and not seek to control behavior, especially in this environment where the use is more tolerated. Here, the harm reduction application is to offer help without overt efforts to control. The level of family, friend, and communal influence may vary based on differences in cultural norms and across social groups. And this will affect how you approach and your health behavior messages to friends and to family members. We recommend focusing on giving information to inform, empower, and encourage individuals to be as safe as possible, whether they choose to abstain or choose to use cannabis. In general, respecting self-directed decisions and promoting personal responsibility have appeal across social groups in the US. This works when health messages offer helpful tips, suggestions, and strategies instead of warnings, and admonitions, or threats. Messages are seen as more positive and constructive when they focus on what to do instead of what not to do. Historically, cannabis and drug prevention messages have offered fear and not hope, warning and not assistance. This needs to change. Emphasizing risk and substance use avoidance feels paternalistic, and it feels agenda-driven, and it turns off potential audience members. So when experimentation and responsible use are accepted as reality, that gives us more options to prevent harm. Remember, harm reduction is about meeting people where they are, even if they are not where you or I think they should be. So two researchers in this area, Jonathan Beasley and Stephanie Field, they wrote about cannabis among college students. And in their research, they identified several strategies that they promote for harm reduction practices. We wanted to share a few of the strategies that they outline. In their recommendations, they encourage an emphasis on making students more informed, so that if students choose to use cannabis, they can develop more responsible and safer consumption habits. 1, explain differences in cannabis products. Not all products are equal. Smoked plant cannabis is different than oils baked in edibles or concentrates that are vaporized and inhaled. These can have very different concentrations of THC. The differences in how they are consumed also affects how quickly they render a pharmacological effect. Second, encourage those who use to take tolerance breaks. This minimizes withdrawal and makes periods of abstinence more normal. It will also renew the experience of a high when people begin using again. 3, encourage breaks before important events. And for students, that can be like an examination or something else that's happening either in their academic life or in their professional life or in their personal life. But there is a belief that cannabis can be a cognitive performance enhancer and that it calms or focuses the mind. This is probably not accurate, at least as far as we can tell from current evidence. Instead, for those who use regularly, if they stop using, they experience withdrawal. Thus, using before an important activity falsely seems like it's helpful. Instead, if people who use cannabis practice mindful and intentional use, they'll have positive benefits in separating party behavior from academic achievement, or in setting up an opportunity for more responsible lifetime relationships with cannabis. And to these 3 points, we wanted to add 2 more. For those that use, it's important to trust your supply. Purchasing from retail locations that have safety controls in place is one way to do this. Testing for fentanyl is another way. And finally, don't use on campus. This relates to the fact that the University of Arizona, along with all other university campuses in the United States that are institutions of higher education recognized by the federal government, they're required to enforce a ban on use of illicit drugs, including cannabis. Federally, cannabis is still an illegal substance, even in states like Arizona where state law permit use. All right, our final key principle, a balanced view. Only focusing on health risks can feel disingenuous to those who use. Psychologically, we tend to overestimate our potential to benefit from an action, and we tend to underestimate our odds of being harmed from it. Beyond this, people also form their opinion about personal and social risks based on observations. Describing cannabis as a harmful and risky endeavor doesn't fit with many of people's personal and observed experiences with it. So a balanced view of cannabis should acknowledge, first, that cannabis does come with real risks, but not all use results in immediate or in lasting negative health consequences. Second, medicinal use for pain can reduce risk of overdose and death from other substances and improve life functioning for those with other health conditions. And third, when we highlight more appreciable and recognized ways that cannabis can negatively affect a person's life, like criminal penalties or being expelled from school, remember, don't use on campus. It becomes possible to build a stronger connection with those who may face cannabis risk. So beyond health risks, you or those you know and those that you serve professionally, they'll also have life experiences related to legal and social consequences of cannabis involvement. So this is also true at the population level. And I wanted to share this table with you. As a doctoral student, I was asked to write a policy brief describing the effects of legalizing cannabis at the state level. So in 2017, when I wrote this brief, I reviewed evidence from Colorado, Alaska, Oregon, Washington State, and Washington, D.C. At the time, those were the states that had legalized recreational use of cannabis. In my brief, I concluded that the health risks from marijuana use are not trivial, but they should also not be exaggerated. Prior to allowing legalized cannabis possession and use, all of these states already faced costs and faced risks from illegal cannabis use. At 2017, or at the time that I reviewed this data, recreational use laws did not increase any of those risks in a meaningful way. The evidence is still preliminary, but based on findings from these states' early experiences, it appears that legalization does not exacerbate issues that already existed from illegal marijuana use. However, it did improve government's ability to regulate and to control the marijuana market and generate tax revenue from its sale. So as this table shows, when we look at potential impacts from legalization, the biggest benefits result from decriminalizing, or what that means is not harming people by putting them in jail, giving them a criminal record, and it reduces the costs of the justice system being involved. And on that last row, it increases tax revenue. Looking more recently, as late as 2021, the Cato Institute wrote an updated report that was exploring these same issues, and they confirmed that these trends that I noted from before remain largely true. The authors write, quote, "The data so far provided little support for the strong claims about legalization made by either opponents or supporters. The notable exception is tax revenue, which has exceeded expectations," unquote. So it's important to note that there can be harms from use as well as harms from how we attempt to deter use. This is reflected in the change in criminal justice involvement. Criminalizing cannabis use has been tremendously harmful and costly. Legalizing cannabis reduces both. But this does not mean that we should view cannabis policy as a binary choice between total prohibition or total liberalization. We should neither want a situation of authoritarian control nor what we might call a wild, wild west of no control. An example of this is the popular view that cannabis should be regulated like alcohol. Regulating cannabis like alcohol would represent a commercial free market approach. In the US, for alcohol, this has been problematic. Today, we suffer from more deaths from alcohol than all other drugs except tobacco. US alcohol regulations are the example of this same faulty, dichotomous thinking of little regulation versus a lot of regulation. And we commonly fail to implement regulatory policies that would be more effective in reducing harm. For alcohol and cannabis, there are many middle ground options. This graphic shows 12 alternatives to regulating cannabis supply. These were developed by the RAND Corporation, a nonprofit research organization. RAND was asked to examine potential policy options for regulating cannabis, and they were asked to recommend an approach. They did this carefully, and they published a comprehensive, over 200-page report. Interestingly, the experts who worked on that report, when they were asked to share their opinion, they actually didn't agree on one single position on this graphic. Right? They weren't saying, well, there's 12 and clearly one is the best. Instead, they noted that each position has strengths and weaknesses, and different team members preferred the trade-offs in different policy positions. Where they did agree, however, is that states, in their view, should balance public safety more with individual liberty. This requires aiming towards a policy position more towards the center of this graphic, towards the middle of this chart, somewhere here, and moving away from the edges or away from the extremes. Unfortunately, many states are adopting a standard commercial model that's down here, or what the authors refer to as the commonly discussed options, which is let's just prohibit it, make it illegal, not allow anybody to use it, or make it available similar to alcohol. And they don't consider more middle ground options. In this figure, we see that the standard commercial model is only 1 degree removed from the extreme of no regulation. In this presentation, our goal is to invite you to consider how you can have a safe, responsible, and balanced relationship with cannabis. This can extend to your social community and what role you play in helping friends and families live safer lives. For some, this means not using. This is especially recommended for adolescents and pregnant people. If you are using, we hope we've shared principles and recommendations that will help you use responsibly. As potential professionals who may work with others who are using cannabis in the fields of medicine, public health, public safety, social services, criminal justice and human relations, and other positions like that, you can also apply these principles to promote health and reduce harm. At the personal and at the social level, harm reduction principles allow for a balanced and an intentional effort to promote well-being. Our goal is for you and the public to be as healthy as possible. Thank you all for your time.